Hey everyone, welcome to the first episode of the Get Level Sessions. So on this podcast, we're going to be bringing in guests to have deeper conversations to help our guests share more details about a specific topic. So if there's anybody out there listening and you have a message or a story that you want to share, reach out, let us know. We'd love to have you on the show. So joining me during this journey for the Get Level Sessions is Kyle Sweitzer and Caitlin McCaslin.
Hello. It's good to be here. I'm excited for what's happening with this show because, like you just said, it's going to have a mixture of messages, a mixture of different types of content that we can share through the community, whether it be sporting events, whether it be politics, whether it be any types of news, whether it be what we're going to discuss today. So a lot of different things and avenues we'll be able to take with this show.
Yep, I'm hoping we'll have a lot of different guests come on this show throughout time, and we'll get to meet a lot of interesting people, hear a lot of very interesting stories, learn a lot of good information about the community and what kind of resources we have here.
Yeah, I think one of the cool things is if somebody just has a one-off message, they can come on this one and share it. They don't have to have their own whole podcast. I think a lot of stories fall through the cracks that way. They don't feel like they have a way to get their story out, and this really opens the door for that.
That's a really good point because, someone can be maybe overwhelmed with the thought of having to come out with content every week or every other week or maybe not even a whole series, like you just said. So that's a really good point.
Yeah, and it's a great opportunity for us to have our own interviews. So not only can people reach out to us and say, hey, I'd like to come on the show and share my story, we can reach out to other people and say, hey, would you like to come on and share your story? Because I heard about you, through whatever avenue it might have been, and I'm very interested. Want to get it out there for everybody to hear. So,
well, what do we have up for this one?
Okay, so for the first episode, I sat down and had a conversation about Mental Health Awareness Month, which is right now in May. So I was joined in studio with by Miles Riley and Gwen Malcuit. Now, they're both from Community Mental Health Care right here in Tuscarawas County. And we also had Jodi Salvo in the studio that day. Jodi is the Director of Substance Use Prevention Services at PFCS, Personal and Family Counseling Services. And she also coordinates the Anti-Drug Coalition in Tuscarawas County. Okay, that's a mouthful. But so needless to say, I was completely surrounded by subject matter experts that day.
And that's awesome because I think with this subject matter specifically, I think there's a little bit of a stigma on talking about mental health or a little bit of misunderstanding. I know that they've been trying to get the word out and trying to get, just more awareness about mental health and what it means. Because I think that, movies tend to define mental health in a not realistic way, or we always tend to lean toward the extremes of what mental health or mental illness is. So I'm excited to hear what they have to say and, what we can learn from them.
Yeah, this conversation is really going to break down a lot of misconceptions about that conversation of mental health. We talk about, warning signs, different types of mental health issues that people can experience, and how really we all experience mental illness on some level or another. So the conversation is very interesting.
Yeah, I would agree. Like you said, the stigma and the stereotypes, I think we're starting to see it a little more than we used to, but it's still like people really shy away from it, or they'll only want to tell you part of their story. And I think the best way to learn is from hearing everybody's story and know that somebody else is going through that same struggle.
Yep. All right. So after we listen to this conversation, the three of us will come back. We're going to kind of just discuss what we heard, what we learned, because we discovered a lot of new things during this interview, during this process. So it's very interesting, and we're really excited to bring it to you. So here we go. We'll go over to the conversation. So we're really excited today. We've got our first few guests in here. We've got Gwen Malcuit and Miles Riley from Community Mental Health Care, and they're coming in to discuss, Miles, it's called...
This is Mental Health Awareness Month. May is Mental Health Awareness Month, and just talking about some of our services, some of the services that are available in the community, and some of the barriers that people face in the world of mental health, both accessibility and just some misconceptions. Basically want to leave here today with people having a better understanding of what it takes to walk through the door or make a phone call in this case these days to talk to somebody professional.
All right, excellent. We also have Jodi Salvo from the Anti-Drug Coalition. Hey, Jodi.
Hey, how are you doing?
We're good. We're good. So I'm going to kind of take a back seat here. I'm going to let you guys run the conversation. If I have any questions from my standpoint, I'll jump in. Jodi as well. So we'll just kick this thing off. Miles, Gwen, go ahead.
All right. Well, thank you. I'm glad to be here. You glad to be here, Miles?
I'm always having a good time.
Yeah. So I think this is conversations we should be having all the time, about mental health and substance use and awareness, but May kind of gives us a nice stage to, I think, talk about things that maybe would otherwise go untalked about. But I think mental health has really been kind of front and center lately with COVID. I think there's been a lot of speculation that this is really having an impact on people now, but also, in the months to come, what's going to surge and what's really going to be the needs for people. So I think it's a good time to talk about access.
Now, before we jump into that, though, what are your roles at CMH?
I'm the Director of Marketing and Fundraising.
And I'm the Clinical Director of our Behavioral Health Services.
Right.
And I'm going to throw a question out there because May is Mental Health Awareness Month. But what does that entail? When we say the word mental health awareness, what kind of issues are we talking about there?
I think that it can encompass any type of mental issue that someone's having. I think it encompasses substance use. Mental illnesses run the gamut, right from, mild things that anyone might experience to more severe issues. Which Miles and I have been talking a lot about, the kind of that end of the spectrum lately. But, I think it encompasses everything.
So from depression to anxiety to adjusting to new life situations?
Yeah, and I think one of the things is this month allows us to talk openly about what mental health is, and more specifically, just educating people on what that looks like. Some people, when I'm at the booth and walk by and people like hit their husband, they'll say, you need this, you need some mental health care, and they all laugh and they'll keep on walking. And it's all lighthearted and I get it, but, those are the people I'd like to pull aside and say, what you're saying is, you're kind of brushing it off. That's not great. 'Cause inside I'm kind of dying when you say that, because I know that mental health doesn't have to necessarily be, that high end of the spectrum where we're talking about severe mental illnesses, like schizophrenia can be a very severe condition. Is just a good example. Where on the other end of the spectrum, you have somebody who, it could be a loss of a pet, loss of a grandparent, loss of a parent, loss of a job. Right now with, I know unemployment has been a real challenge for people trying to get unemployment. People are waiting months, going how many months now without a paycheck coming in. That's a whole nother level of stressors, especially if you have a family that you're supporting. And those kinds of situations and those mental places are all new for most of us. I know we did have a recession, obviously, in 2009. Some of us were working age at that time. Some of us were still in school and just now finding this in the workplace. So this is new for a lot of people. Some people have been through it before, but not quite like this. Obviously, this is very new. But along with that, you get a lot of new, I think maybe not necessarily new mental health issues, but maybe those mental health issues are being brought to the surface a little bit more. So if somebody was dealing with anxiety and getting through life okay, and all of a sudden you hit a wall, that anxiety that you had could get to an unmanageable situation where it's inhibiting your ability to be positive in the day, to put a good front on in front of your family and be the strong one to lead your family if you're a parent or a child can lead a family as well. But it's just a time where people are getting pushed against the wall, and I think some of those underlying conditions could also be getting pulled up to the surface.
But all that experience is really subjective,
Sure, 100%.
What might be a total walk in the park for one person is a total disaster for another. And I think we tend to focus on what's right down the middle of the road, and things that are on one extreme or the other tend to get overlooked. So, people that are maybe experiencing something that's maybe not that big a deal to most, but is, really affecting them, or people that are really in severe situations. I mean, it's easy to commiserate with that which is familiar to the majority of us. But you have people that are, all over the place, different experiences. And
Well, you hear the governor and you hear Dr. Acton and everybody talk about, alcoholism on the rise during this time, and people who are in treatment struggling to continue that treatment because they don't have their group therapies to go to. They're not able to meet with their counselor in the way that they were used to. And during that recovery process, I think you really rely on consistency.
yeah,
And all of a sudden you're throwing a big stick of dynamite into your pattern. So when they're talking about mental health issues on the rise, or alcoholism on the rise, or drug use on the rise, what does that mean? I think it means two things. One, yeah, you're sitting at home a lot. Not a whole lot, if you play Call of Duty, can't play Call of Duty all day. At some point, you're going to have to take a break. I could play Call of Duty all day. But no, it's you're really sitting there with your own thoughts, and sometimes that can be overwhelming, and reaching for a beer or a drink can be pretty easy to do. And that's not unhealthy. It can be okay to responsibly enjoy those things, but if you have a disposition where those things become a crutch, then you have a real problem. And we are seeing an increase in that during this time.
I think it matters too who you're quarantined with.
Sure.
Yeah. Talk about healthy faces and healthy places. I mean, if you're kind of trapped indoors with maybe a family system that's pretty dysfunctional, it's hard to get away from it like maybe you normally would.
Yeah. And what about the reports of the rise in child abuse or domestic abuse?
Yeah, absolutely.
Yeah, during this time.
Yeah, that's been I know we've had that on our crisis hotline, an increase in calls, individuals that, husband's home, they're home, kids are home, and they're just kind of stuck. And how do you even make a phone call, safely if that person's just kind of hanging around? But, and that just leads to a whole host of other problems. Children, maybe normally in school, are now at home, and now they're witnessing, violence in the family. Boy, that just tacks on a whole lot of risk factors. We talk about that circle of violence, that circle of risk that, children that see these things in their childhood, see violence, see mom and dad, beating on one another, drug use, then they grow up with their own issues, and then that cycle just continues. So, yeah, there's a lot more far-reaching tendrils of this that we'll see. We'll see them in the future if we're not really, I think, vigilant about helping people address them now.
Yeah. I think also, I think we're kind of doing it without realizing it, but going back to that original thought that I was speaking on, where mental health we're trying to define it, but we're having a really heavy conversations in a really short amount of time, but trying to address them all. One of the things we get this question a lot. If somebody were to come to community mental health care or to PFCS or any other agency, we all hear the same question. What does it look like when somebody walks through the door or make that phone call? And after they say hello, that changes immediately for each person. It depends on where they are. If it's a crisis situation, it depends on they're calling on behalf of somebody to learn more. It depends on if they want to just talk to a counselor or if they want to be with a psychiatrist. It depends on what their issues are. And we do try to get some information over the phone, make sure they get placed with somebody who can do it.
It's the right fit.
The right fit,
yeah.
Right. So what that looks like is different for everybody. I think what most people will find who have come into a facility or into a treatment program not even treatment program, just talking to a counselor, you'll find that the first day, the first 15 minutes is the scariest 15 minutes while you're waiting for that counselor to come out of their office,
Yeah, you got
call your name,
Yeah.
and then you meet
build
that
up in
person
your
and go,
head,
oh, this person's just another person.
human.
Yeah, and they actually, their job is to not make you feel uncomfortable.
Right.
Quite the opposite, and they're really good at that. That's their profession. So once you get past that, walking down the hallway to the office, all of a sudden that fear drops away. And now you've made the choice, you've made the call, the hard part. You've walked through the front door, the really hard part. And now you're walking down the hallway and it's a lot easier. You've kind of jumped down the slide and you're going in the right direction.
Right.
Another thing I think, just talking about accessibility to care, some things that I see are people who came in, they met with somebody, they didn't really connect with that person, and they don't come back. And I think, again, as Mental Health Awareness Month is an education opportunity, one of the big things that I always tell people, if you don't like that person or aren't comfortable with them, if you want to talk to somebody else, somebody younger, somebody older, man, woman, whatever it is, that is a request that you can tell your counselor. They will not be offended.
You can tell the front
You
desk.
can tell the front desk.
You can call me.
You can call
You can
me.
call Miles.
Yeah, you can call anybody.
Yeah.
And we'll make sure that we find somebody.
Right.
And this is the case, again, for any agency.
I mean, you're sharing some really intimate stuff.
Right.
When you're in that room with that individual. And we're all humans. I mean, you may not click with, any number of people. So, I mean, there's always that chance you're not going to click with that counselor. And they always have the right, to switch and find someone that.
Well, and here we are talking about being in a room with somebody, and right now that's not the case. A question was asked, I don't know if you were on the call, but people were asking about reopening and what does that look like for each agency. And I think for the behavioral health world, that really we never really closed down. We never stopped providing services. We changed the way we deliver those services for safety of our employees and the safety of those who we serve. But we're using telephones, we're using video conferencing. We aren't turning anybody away, certainly. And crisis is still walk-in during regular business hours, and then we have our 24-hour crisis line. But we're not reopening. We never really closed. So I think some people also thought that when everything got shut down, that we were also shut down. My point being, though, we're seeing more people being comfortable talking on the phone rather than video. Yeah. I don't know the exact breakdown of that age-wise. I would assume that younger folks in that, teenage
20s.
to 25-year-old range, and I guess the millennial and, people who grew up with a computer in front of them,
right,
find that much more comfortable. Older people may find that a little more alien, a little more comfortable. But what you're doing is, your first encounter with a counselor is going to be either over the telephone or through video conferencing. And that's not the same as being in front of somebody. I think you can learn to be comfortable with that, but it could for some people take a couple sessions to feel comfortable with that.
Right.
But I wouldn't let that get in the way of continuing your treatment or your sessions with your counselor, because it does become normal. And once you the first couple sessions when you're with a counselor, having gone to counseling myself, is pretty awkward. You're trying to figure out, you have a question that you don't know what the answer is. You're looking for tools to get through what you're dealing with. If you knew how to do it, you wouldn't have to go there. So the first couple sessions is just feeling it out. You're feeling each other out. What can I, if I'm a normal cusser, can I cuss in front of this person? If I'm faith-based, is this something that my counselor understands the way that I understand it? Is that a conversation that I can have and incorporate in what I'm trying to express? All of that is very, very difficult in the first couple sessions, but after a while it starts to become normal and the conversations start to open up and become bigger. And I think it's the same. You're going to find that struggle whether you're meeting in person or whether you're over the phone or whether you're doing video conferencing.
Yeah, I think our providers have really surprised themselves with how adaptable they've been and how quickly they've gotten used to the phone. It's different, but yeah, I think they've surprised themselves, and we're getting generally good feedback from the people we serve, that they're happy to at least have that opportunity.
Gwen, do you
rather than
think it's
seeing
going to change after we've opened up here in Ohio, that this avenue of counseling might?
We just had that conversation today, actually, at our staff meeting. I think that there's going to be enough public opinion out there that I think we'll see some version of this telehealth stay. It's really hard to argue how this impacts accessibility.
Sure.
Really good example is what we're seeing with our normal no-show rates. Just people that make an appointment, don't show up. That happens. So our no-show rates have decreased like astronomically because it's a lot easier for people to pick up a phone than it is to try to find a ride, try to find a babysitter, whatever. So that's going to be a hard argument to make, that we should take all of this away when this has really enabled people to get the help they need and get it quick.
Yeah, I think with the phone and telephone can sound like it's inhibiting access. And our, I guess as a business, we're saying, no, it opens up accessibility. It does both.
Yeah.
Because you have the mental part of it, getting like being comfortable with the new way of delivery, but also we can now reach people who have been, older folks who may not have transportation available to them, or people who just don't have transportation available to them at any age. If you live in Yorksville, Denison area, Newcomerstown, Dover, New Philadelphia can be a long way away if you don't have the means to get there.
And people with chronic medical issues too, that really
Right.
struggle to get out of their house with mobility. I would love to see it, come to a point where people have that choice, that
Right.
option.
But I think, Jodi, your question was, do you see that going away or changing? This is obviously going to be mandated or set forth by the state and how they want to reimburse us or reimburse the agencies for those services. But I think you're seeing a national trend of telehealth and incorporating video and telephone interactions in that one term, becoming very much the norm. So you have not just local agencies, but you have larger corporations. There's two that I'm thinking of. One is Talk Help or something like that. There's these nationwide agencies that do telehealth. And they're not necessarily in your area, but they're counselors that you can reach, usually paying out of pocket. But people saw, there are people out there who saw that telehealth is a wave of the future. And as younger generation moves up into that middle age and older, they're going to be very comfortable with that technology moving forward. So as a community of providers, this has kind of helped us and forced us to move into the future a little bit with that delivery system.
Yeah, there was a push for telehealth even before this. So I think that this has been an opportunity to see it can work. Maybe it's not perfect for everyone, but it can work.
I mean, even 5 years ago, it was, you have to have this special TV, you have to have this special camera that turns around when you're not using it. That you have all these, investing thousands of dollars in these video conferencing systems. And now we're just using our phones and computers. Like, it's kind of...
It's Space age stuff.
Yeah, right. It's like Marty McFly is going to come around the corner at any moment now. But it's probably long overdue. And again, when you see how many people are that we're able to reach now because of this technology and the allowances that we have, from our state and federal levels, I think it's a good thing.
We have a saying in this field: no wrong door. This is one more door. So that's my opinion. I don't know if the state cares about Gwen Malcuit's opinion, but.
Well, I think, we have Mental Health Awareness Month, and it is about education, awareness, decreasing stigma. And you have to wonder, just the access to telehealth might just make it easier for people.
Did you say telehealth? Like, that's fun.
Telehealth.
When we talk about how uncomfortable it can be that first time, just even getting used to making a call, seeing, okay, I'm talking to another person. They're allowing me to process what's going on, maybe helping me find a starting place. It might just assist us in decreasing some of the stigma
I think
and
so.
the barriers.
I think so too, especially like Miles said, when you talk about the younger generation. I have 3 adult sons, and like some of their best friends are people that they're online. They've never met them face to face, but that's normal to them. I think this younger generation is going to be a-okay with these types of service delivery.
With your youth-led groups, you see it there too, where the conversations, you've been in it long enough to see the change from even 10 years ago to now, that it's not as weird or goofy as a conversation in the high school level as it was before. Now it's very serious, and I think they take it very seriously. And I think there's some enthusiasm, in fact, to speak more about it and to wrap an arm around a shoulder and be comforting, to see somebody who's struggling with getting bullied, or maybe recognizing that they're not getting the meals that they need, or recognizing that something at home's going wrong. And I think kids are way more, and pop culture's done a lot for that. Social media's done a lot for that. A world where school shootings and terrible acts have unfortunately propelled the conversation about mental health. And we live in we can definitely get very down and saddened by the state of the world, but you can also see a lot of hope and a lot of good things there too, because of the way people react and the way that we're learning to recognize pain in other people, and the need for helping other people too.
Yeah, I think at the risk of sounding Pollyanna, there really can be a silver lining in adversity, and we were talking about this during a recent Zoom meeting we put on about how creative and innovative people have gotten, how much they've reached out to other people, and this is kind of propelled that. Sometimes it takes adversity to make those hard conversations happen and really drive meaningful change, and you got to try to find the sunny side sometimes.
So let me throw another question out to y'all. With just the whole mental health issue, what can someone expect when they reach out into counseling?
I already answered that question.
Did you get that on?
Yeah, as soon as you say hello, it changes
It
for
does.
everybody. Yeah.
Tools, opportunity to
I
speak
think
openly.
I've talked a lot. Go ahead.
That's okay, Miles. We expected that. I think what people can expect is individual, but it's also going to be person-centered. So it's going to be driven by you. You're not going to go into an office with a therapist, and the therapist is going to say, okay, step 1, you're doing this. Step 2, you're doing that. These are your goals. These are your objectives. It doesn't work like that. It's going to be driven by what you want, what you need, what your strengths are, what your abilities are, what your barriers are. So that first conversation, there's going to be a lot of talk about where are you at right now, where do you want to be, what tools do you have to get there, and what can I do to help? Because really it's not about us fixing people. It's about helping you fix yourself.
Awesome.
Yeah. I didn't say that.
No, you didn't.
I enhanced what you said, Miles.
No, I think that's a good point. And I think that happens with any age, if it's a substance abuse or like I said, grief, anxiety, depression, or even something that's more compounded than that.
Yeah.
I think that applies across the board.
I'll tell you what, though, Miles, I know you answer this question well because I've heard you answer this before. How do you know if you need help?
I think if you have the thought of, should I talk to somebody? And then you go a couple days and you kind of think about it again, and that's probably the time to start calling somebody. For a lot of the people that we serve, we see about, and this is probably a high rounding up of our population that we see, about 70% Medicaid patients. So I think one of the barriers for maybe slightly older, like I would say middle-aged folks, who fall into that or that Medicaid area for coverage, may have been told at one point that they don't qualify because they make too much money or because this or that or the other. And 10 years ago, that might have been the case. Things have changed a lot. The world of Medicaid has opened up for a lot more people in Ohio. And I have a feeling there are not a large part of the population, but a significant part of the population who feel, I was told no once before, and that's probably how it is now.
Yeah.
And that's probably not true anymore.
No. It's not.
And in fact, at our agency, we take everything. We take private insurance, we take Medicare, we take Medicaid.
We take nothing at all.
We take nothing at
And
all.
it's a sliding fee scale.
Yeah, we have a sliding fee scale, so you can pay cash for services, and it's based off of your income and your household occupancy. In a lot of cases, it becomes very affordable. So anybody can come in. One of the things we always say, there's people in suits and there's people in gym shorts. There's all kinds of people coming through the front door.
Yeah.
It's a mental health doesn't care how much money you make.
No.
And that's how we've built our business, and our mission is based on that.
Yeah. I don't care what you come in and just come in, because I think that's the problem with mental health is most people that we see walk through our doors waited far too long to finally make that step. Someone asked in the very beginning, what do we want to see as our ideal result of Mental Health Awareness Month? I want people to feel as comfortable coming to see a counselor or a psychiatrist as they would going to see their primary care doctor. You don't wait until your spleen's exploding to go see your family doctor. I don't feel quite right. I'm going to the doctor.
Right.
I want it to be like that for mental health. The brain is a part of your body. It gets sick too, and it shouldn't be held separate as some unthinkable occurrence. Oh my gosh, there's something wrong with me mentally. I can't take that step. That's what I want to see.
Yeah. We get a lot of people too. Sometimes people don't always recognize it in themselves. Sometimes other people are recognizing it in their loved ones. Like a wife may say to a husband, or whatever the situation may be, somebody you live close with, may bring up the subject to you and say, are you feeling okay?
Yeah.
You've been down for a couple of weeks now, and it's kind of worrying me.
Sometimes I think we get blind to ourselves a little bit.
Oh, 100%.
It's hard to see.
I'm in 100% denial all the time.
I think people think, I know myself. So most people don't. They don't know themselves very well. So yeah, sometimes it takes another person to.
Yeah. So we get a lot of people who call in asking about what services we provide, or visiting our website and following up with questions about what services are available, not just for themselves, but for a loved one.
And we get a lot of people that come in that first visit. Oh, what brings you here? My wife told me I had to come. Yeah. But a couple sessions down the road, they're there because they want to be there. So sometimes those first steps can be rocky. That's okay. Well, we'll work it out, and most people find a lot of reward in it once they take those steps.
Well, one of the top, I know I'm asking a lot of questions and probably answering them myself.
It's a one-man show.
Yeah, you guys can go whenever. One of the hot topics, or one of the more popular topics, and I think we had some really tragic events that aligned with the beginning of the shutdown that made people ask, are suicide rates on the rise or on the increase? And I still think that the data is kind of out on that. Again, it was sparked by by a couple events that happened very close to each other in time, like within a span of 2 or 3 weeks, and it was a terrible time. Just seemed like every day you wake up and it was something else. But I think that started the mindset that suicide rates are on the rise. Again, I don't know if the data is there to back it up yet, but I think it's something that Gwen, you can talk to or talk on a little bit about what it looks like, or how do you recognize those signs?
So whether they're on the rise or not, or whether this is directly related to the pandemic or not, you can't ignore that what we're seeing right now in terms of people being isolated, that breaking of human connection and relationship, possible loss of income, loss of job, loss of status, all of those are the red flags that we're looking at when we're assessing suicide risk. So that's undeniable right there, that these are some really significant risk factors. Fear of losing loved ones, fear of sickness, those are all things that we're evaluating when we're thinking about risk. So we have risk factors, and then we have protective factors. So people that have strong connections with loved ones, people that have good coping skills, the absence of those things means even more risk. So, everyone responds to stress differently, but certainly if you see these things in a loved one, someone whose mood is changing, behavior is changing, increased substance use, giving away prized possessions, researching death, any of these things, take it seriously. It's always okay to ask someone, are you all right? Are you okay? Are you thinking about suicide? That's one of those old misconceptions that you can't ask that question because you're going to plant the seed in their head. That's baloney. It doesn't work like that. Worst case scenario, they're going to laugh at you and say, no, I'm not suicidal. But what if they are thinking that? And you don't ask that question, that's not something a lot of people are just going to volunteer. So it's worth it to ask. Absolutely. But I think time will tell, what we really see in terms of data in suicide rates rising.
Yeah. And I think if you are that person asking the other person, that puts you in a position as well. That's very stressful, increased anxiety and fear. And I think you can't ignore yourself in that situation too. While that person may be dealing with something and may be resilient to seeking help, that doesn't mean that you shouldn't also try to find somebody for yourself.
Right.
That's a heavy burden
It is.
to bear. And again, nobody is born with that coping tool to handle that. And there are people out here in the community, incredible amount of resources in this community who are ready to help and ask questions, or at least direct you to places that can answer those questions for you.
Well, real quick, how does that work then too, like with a loved one? So you're saying your loved one, you could ask them the question, they could seek help, or you could seek help or guidance, but can you go together? Can you?
Yeah.
I'm going to tell somebody I'm going to come with you.
Right. Absolutely. Yeah. And that's something we really encourage. We get a lot of people calling, loved ones calling saying, I know my husband needs to see somebody, but he's really reluctant. Come with him if that helps. Bring his dog if that helps. I don't care. Just whatever it takes to get that person in the door. But yeah, absolutely. Go with them if that's what it takes.
So Miles and Gwen, just kind of want to throw that out there. What if this crisis happens off hours, late at night, you get a call for someone? What do you tell someone to do?
Well, it kind of depends on what the situation is. If we're talking imminent risk, someone, God forbid, has a gun, has a knife, we're gonna get 911 involved. But if this is someone who's not at imminent risk, but there's some genuine concern, we have a couple different options based on where that risk level is. So it may be getting them to the emergency room, it may be calling an ambulance, or it may be getting them in the very next day for an outpatient appointment with one of our therapists. There's a lot we can do. And that guidance and that kind of monitoring, gauging where that risk is, that's available 24/7 to people.
So if someone calls, first give the crisis line, but if they call the crisis line, who's on the other end? What might someone expect?
Well, we have trained behavioral health professionals that are answering that line 24/7. So they're all trained in basic mental health, substance use, lethality, and risk assessment. They're very knowledgeable about local resources, not just what we have at our agency, but also what's out there. And they're great for just support. We have a lot of people that call that they're not in crisis. They just need someone to talk to. They just need a warm, friendly person to let them know they're not totally alone in the world.
Sure.
So it can really function as a hotline, and we call it a warm line sometimes too. So it's, got a lot of different functions, or just information. In the middle of the night, you want to know, hey, what's out there for this particular issue. They can clue them in.
Phone numbers?
330-343-1811.
That's for Tuscarawas County.
That's for Tuscarawas County, and 330-627-5241 for Carroll County. They both ring into our Dover office, but
Nice.
Yeah. So I think that, we wanted to come in today and honored to be the first.
Yeah. I'm glad you guys
Very
did.
cool. Yeah. I hope you're going to get your Casper mattress sponsorship out of this, or whatever they are for podcasts.
Yeah, but purple.
Yeah, purple. Is that what you want? Yeah. I'll take one of those too.
I just got a Helix. They're pretty good too.
Oh, yeah.
This is the purple channel, so we'll just.
Yeah, we need to get your sponsorships up. Benson's is a good one too. Good salad. Yeah.
Yep.
No, I appreciate you having us come in, and I know we came in with a really loose idea of a conversation that we wanted to talk about.
No, but it's something that needs to be talked about.
Yeah.
And I'm glad you guys did. I'm glad you wanted to do this. Happy to do it again if there's more information you want to provide at a later date.
Sure.
If anybody reaches out and has questions to you guys that you're like, hey, that's some important stuff we want to come back in and fill in, we can do that too. Key takeaways from this conversation. If you think you need to talk to somebody, you should and you can.
You're probably already at the point that you need to talk to somebody. Yeah.
And if you're worried about, well, what if maybe they can't help me? They can. Mm-hmm. You have all sorts of resources. Yeah. We just talked about all of them. No matter what it is, no matter in what way they need help, it can happen.
It can happen. And call and ask. We can talking about getting help if that's what needs to happen.
That's a great point. I didn't even think about that. So if you're just wondering, what do I do? Yeah. Call in and ask, and somebody will help you figure out what steps to take to
CMH. And if you call in asking about resources in the community, we have a care coordinator who operates kind of like he's an all-time quarterback for case management.
Right. Yeah.
And
king of all resources.
King of all resources.
He knows them all.
Yeah. And that person can help you. His name's Mitch. You call in and he can help fill in. If there's questions about food, clothing, transportation, utility payments, those kinds of things that you might be asking, like, I don't know exactly where to call. That's a call you can make too. But I think if you call, and I just want to be careful, like, we're here, we're employees of CMH, but these resources, that phone call can be made to just about any agency, and any agency would be prepared to at least funnel you to something closer. So if you don't get the answer you're looking for right away, make sure you ask, do you have somebody else that you could recommend to call? If it's not us, if it's somebody out there, I think everybody's pretty prepared. And I think that's what makes this community pretty amazing. I think, right now we're not sitting around each month in our meetings, the Anti-Drug Coalition, the Opiate Task Force, or Addiction Task Force, whatever it is now. Yeah. Healthy Tusk, we have all these bigger meetings where sometimes 30 agencies are represented. And to think that there's 30 agencies all providing unique services to Tuscarawas County and Carroll County is remarkable for a county our size and as isolated as we are. If you look at the map, Tuscarawas County and Carroll County kind of sit out in the middle of nowhere. We're not Cleveland. We're not Columbus. We're not Pittsburgh. We're not.
We got
I
more
guess
going on than
Youngstown doesn't. I don't know if Youngstown fits into that anymore. Sorry, Youngstown.
Well, it goes back to that no wrong door. So I think you can start your journey just about anywhere, and we're so interconnected. You're going to get to where you need to go.
Yeah.
And we all play well together, the agency.
We do.
So, I think we're all very quick to say, hey, this agency has this,
Right.
give them
Yeah.
a call or reach out. And
And I've definitely noticed that in my time working with, you guys and some of the other agencies as well. Is
we're
sometimes
all in this together.
We
really,
share the
you are.
sandbox pretty well.
Yeah. Well, I mean, if this conversation about mental health has, resonated, if you're looking for more information, you're listening to this. I mean, Jodi has done the Anti-Drug Coalition podcast. There were 2 episodes recently about mental health. Miles was a feature on there. So if you
Absolutely.
enjoy listening to Miles' voice, you
Nice
can get
voice.
some more of him.
And you know what I'll throw out again, just on Mental Health Awareness Month? This is a great opportunity. I think May 2020, we will know this is uncharted waters for all of us. There's no one that has not experienced loss through this. I mean,
It's
just-
affected everybody.
It really has. So I just want to encourage people, take this opportunity to acknowledge those feelings you might be having. And if you're finding you're spinning a little bit, things are a little bit off. I love what Miles said. If you're saying, hey, should I talk to someone? If you're listening to this and going, man, I'm just a little bit off, take that opportunity to make a call to see if this might be a good fit, a good opportunity, just to kind of, find a little bit of balance in the middle of this. And I think that's a really great way to just take advantage of Mental Health Awareness Month, that we're hearing about these resources. And
Absolutely. Yep.
Right. If you wonder if your problem is too small to talk about, it's not.
No problem too small
It's not too small.
or too big.
Right.
I mean,
Right.
it's not going to scare us.
All right. Well, unless you guys have anything to add.
I, again, appreciate the opportunity to
Yes,
get the word out and
Awesome.
talk a little bit more about this. We've always, have quick radio spots and you have 30 minutes to get everything you want to say and to have this platform to just kind of have a little breath in between thoughts and be a little more candid with how we respond to questions is really the way that we connect best with people that we serve, both on, when we're out in the world trying to educate people and also when they come in and are seeking services. So I think this platform really fits into what we try to do and how we provide those services. So thank you.
Yeah, absolutely. Well, thank you, Gwen and Miles, for coming in to have this discussion. And Jodi, thanks for jumping in.
sure thing.
I really
It's very
appreciate
fun.
your input. Yeah. Okay. Well, thanks again, and we'll talk to everybody soon.
All right. Thank
Thanks,
you.
Josh.
Thank you.
All right, that was a powerful conversation. That's exactly the kind of conversations that we need to be having. I'll just start by saying that there's definitely misconceptions out there about mental illness. I think it's important to remember what Gwen told us. She said, when your body gets sick, you go to the doctor to get it fixed, right? And then your brain is part of your body. So when your brain gets sick, you go get it fixed. Go to the doctor. We should all be thinking that way.
Well, that's one of my biggest takeaways, is the fact that there's a difference between mental health and mental illness. I kind of equate it to, your physical health. So if you have a chronic illness, you have to, take medication on a regular basis to keep that, keep whatever is out of balance in balance, or you just get the sniffles, or you get sick, or you catch the flu, or whatever. That is a sickness, and it's temporary, and it may need need you go to the doctor, get some extra, or if it's antibacteria, kind of a medication that can bring all that back together. So that's how my biggest takeaway is the fact that there is a difference between mental health and a mental illness, and that we have to focus on that, because I think there's a lot of people who suffer from that category of the smaller temporary things or life situations that we can learn from.
Sure, like in your physical health. So you get a cold, you get the sniffles, you got a runny nose, or you're sneezing, coughing for a couple days. But the same sort of bacteria or virus or whatever might affect a different person worse, and they might get a full-blown upper respiratory infection, and they're out, they need to be on medication for 2 weeks to get better. So it affects everybody differently. Mental illness is no different.
Yeah, I agree. And I think that's so important because, not everyone might be affected by mental illness, but everyone needs to be aware and knowledgeable about mental health, because just because you're not going through it doesn't mean that your friend isn't, and you need to be aware of warning signs and different things like that to really be able to understand what they're going through and possibly help them along in the journey.
Yeah, and anxiety and stress, right? I mean, those are kind of those, I guess when they're talking about mental illness on the larger scale, right? The big disorders that you can be diagnosed with, but anxiety and stress, I mean, I deal with that stuff every day.
Yeah.
We all do.
Yeah.
On some level, right?
Right. And it's not only, like I said, it's not the big stuff. It's not always the big stuff. It's the small stuff that kind of piles on top of each other, that if we don't deal with it. So for instance, you look at like antibodies in your body and like your immune system. Okay, so if you have a weak immune system, you can get sick a little easier. So it's things you have to do to help keep yourself healthy mentally. So you may need to go see a doctor and get some tips on how to deal with stress, or talk to somebody, call somebody. I know there's a lot of hotlines that you can call, and there's a lot of stuff that we talked about in the show, that there are resources available to build your mental immune system. So you can, that way when stress comes upon you, or when things are situational things in life that hit you, you have some defense to that. And I think it's important for everybody to have those kind of tools in their back pocket, and that these organizations around our area are offering these resources for.
Yeah, one of the coolest parts that they talked about was you don't have to just pick up the phone to call for help. You can pick up the phone and call somebody to ask, what should I do to get help? I mean, you don't even have to start that journey right away. You can call somebody, just say, what do you think I should do?
Yeah.
Is this, what kind of situation am I dealing with here? Who should I talk to? You can just get guidance on that to start.
Yeah, no, I think that's good. And like you kind of talked about, a lot of people think of the high-end stuff. Like I know they talked about in the show, like a lot of people think of like schizophrenia and that sort of stuff, and they negate the anxiety and depression. And, I went through that struggle in my own life. I have a younger brother who had a lot of mental illness, behavioral issues, and growing up in that, I mean, we spent time at community mental health, sitting in the waiting room to talk to doctors for him, and my whole family went through counseling with all of that. But then I hit college, I just graduated college, and learning how to cope with anxiety, it felt like you couldn't talk to anyone because you think that mental health is for those big cases. You don't think it's for you, even in the small stuff, what appears to be small.
Right.
Yeah, and Miles said it best in the interview. If you are ever asking yourself, is my problem too small to ask for help? Then the answer is most likely, no, your problem's not too small. And yes, you should ask for help.
Yeah, and there is no shame in that.
Not at all.
There's no shame in that, because you have to, again, I keep equating it back to your physical health. You keep yourself healthy. You have regimens. You take vitamins. You do types of things like that. So why wouldn't you do the same thing for your mental health? It's just your body goes through so much, especially in today's age where, we're going through a time in our history that is affecting everybody, not just the small majority. So if they're a minority, sorry, but it's affecting the majority of us, and we have to understand and be okay with talking about, I'm just not feeling good today. Like there's something off, and it's not because I have the sniffles, and it's not because I feel a cold coming on. Like there's something, I feel down today, and it's okay to talk about that. And that's what I love about the resources that are available, and what these guys have been talking about is that please call, we're here, and there's nothing wrong with it.
Yeah, and One thing that was really cool, they talked about how difficult it can be for somebody to work up the courage or whatever's holding you back to actually walk through the door at a facility.
Yeah.
Well, this pandemic has actually opened up a different door, and that is telehealth. So
Right.
they've really
Right.
seen more people utilizing telehealth, one, because you have to, but it's people that wouldn't come through the door, you know what I mean,
Right.
normally. So, but now that they have the telehealth option, more people that do need to make a phone call are doing that.
Right. And it's a bit safer, I guess. If you do have anxiety about going in and talking about your anxiety, that is a great option for people to utilize.
Yeah, it's kind of like a foot in the door, kind of get you acquainted to it and understanding how it's going to go. And then they can explain to you and help you realize that it's not bad to ask for help, and everybody has to ask for help at some
And
point.
the people that don't have transportation to the facility,
Yeah.
it's just another avenue for them, which I think is wonderful.
Yeah.
I
'cause
hope it continues.
Well, and I think you said in the show too that people are keeping their appointments.
Yeah.
They don't have an excuse as much to, that life comes at you. You can't get to the office. Well, that is an awesome. I'm glad that we have adapted to this quickly, and we these great organizations are pulling this together and still being able to offer the same quality of care remotely over the phone, and that it is awesome.
Yeah. And another, maybe one of our final key points here that we'll talk about, the mental health effects of this pandemic will continue for years. They could open everything back up tomorrow and say everything's back to normal, the way it was, but it doesn't change what has happened to people during this time. So I think that's important for people to remember the effects of this on young children who have seen things and been, I know my neighbors, he said that his children have been worried. They're younger. They don't really understand exactly what's going on, but they know that this is a serious situation. Things are getting closed down. We're not in school anymore. That's never happened to them before. And, as a child, you get scared.
Yeah.
So you don't know what kind of psychological effects that will have moving forward. How many people are going to be timid, worried about, well, when does this happen again? Am I going to lose? Do I continue to invest after this? Where do I put my money? Am I going to lose it?
Right.
So there's a lot of stress and anxiety that's going to continue.
Yeah, absolutely. I mean, I have 3 kids myself, so the social interaction that is missing right now is huge. Now, I know we have the virtuals, I know that, but there is the element of kids just being kids and playing together. So, and that's the thing is I'm not a professional. As far as mental health is concerned, but I can see the effects that it's had on my kids as far as interactions and missing that with their friends. And, it's important to notice that and ask questions and continue to say, hey, how are you? Like, how's your mental health? It's okay to talk about it. And if we get that into the kids now, I think that as they grow, they'll be able to say, okay, it's okay to talk about my feelings. It's okay to say, I'm not feeling up right now. Because I think people feel guilty about not feeling up all the time. It's like, well, I have everything I need. Maybe like, I have okay. I mean, my house is here. I'm still living, it's good. Why do I feel so bad? You know what I mean? And I think people may feel that guilt and it's like, well, it's just an off day, but
yeah. I shouldn't be feeling this way. This,
Right.
like you said, and
yeah, just like, get over it kind of thing. And I think that's just a horrible way to approach that. And I think, this is just admit to that and just say, you know what, I'm just going to reach out. I'm going to reach out and find out what's going on.
I think we're so in the habit of saying we're good. Like if I came in and was
Right.
like, oh, how are you? Like, oh, I'm good.
Yep, I'm good.
And you feel like you can't say otherwise. Like it's like the automatic response should be good. You can't,
Right.
You're not allowed to say anything else. And you're almost afraid because you don't want the pity. And it's like, you're not telling them to get their pity. You're telling them because you just need to talk to someone about it. And there's nothing wrong with that.
Yeah.
there's a lot to do too, I think, with trusting the people you're around too. I mean, if I walk in and you ask me, hey, how's it going today? And I'm struggling with something. I mean, I do feel comfortable to say, I'm actually struggling right now with some things. And if I want to talk about it, I feel like I could tell you what those things are. And so I guess my message to people listening would be the type of person that another person can trust.
Right.
Because you're going to need somebody to trust too at some point.
Right.
So I think that's very important.
Yeah, that was really good.
Awesome.
All right. So any last points for this conversation?
I think this is a great first kickoff episode to Get Level Sessions. And
yeah, we're really excited about this. This
Yeah.
is going to be a good show. This will not be a weekly show. There's not going to be any kind of time schedule for this. This is going to be when somebody needs to talk, we're here to share the message.
Yeah, like a variety show. I like it.
Yeah.
Like it. It's not the same all the time. It's something different every time. So love it.
Yeah. Okay. Well, thank you for joining us. Kyle, Caitlin, very glad to have you guys working with me on this. This is going to be a lot of fun.
Yeah.
A lot of good conversations going to be coming out of this.
Awesome.
So stay tuned and look for the next episode of the Get Level Sessions.